is Dr. Holly Loveless with Queen City Health Center. I'm so excited to talk to you guys today. Today I want to talk to you, why would you get your baby, infant, toddler, child, teen checked in a chiropractic office? Why would they need to have their spine evaluated and checked? They're so young, why would they have any issues? Why would they have any problems? But the truth is there's lots of reasons of why to get it checked, and getting it checked, evaluated, and corrected could help them be as healthy as possible and alleviate a lot of symptoms. So first off, I'm going to talk to you about just in general why your spine is so important to be in alignment. And I've got my trusty old little spine here. And so your spinal cord actually runs within the spine here, and then on the side you can see the nerves actually come out of it. And so chiropractically, we make sure that the spine stays completely straight from the front and the back. So a lot of people have heard of scoliosis, and that's when your spine is distorted like this, and there's a lot of pressure on the spinal cord and these nerves, and there's a lot of symptoms that are associated with this. Now, I don't just look for a scoliosis, but we also look for any rotation in the spine. So if it rotates, it can also pinch or affect the nerve flow that comes out here. Or if it starts to translate forward and goes straight like this, you could see that there would be more pressure on the spinal cord and those nerves and not allowing them to function properly. So with children, they start their life by coming through the birth canal, and there's about 80 to 100 pounds of pressure that gets put on the baby's spine and on their cranium and on their head. So it gets either pulled out or pushed out by mom, and even more pressure can be applied if they use forceps to grab the baby's head and pull them out, or the vacuum that sucks the baby out, or if you're having a C-section, then they pull the baby's head out sideways, and it can twist the neck and rotate the spine sideways. So I've got I don't have a baby doll, but I've got this little bunny. You can imagine if this is a baby, they're coming out and the head comes out first and it gets pulled on. So 80 to 100 pounds of pressure is a lot of pressure. I don't know that I can lift that much in the gym, but that's how much pressure gets put on this little baby spine. And they're tiny, anywhere from 5 pounds to 10 pounds for your big babies. So they're being pushed or pulled out, and the little tiny vertebrae that are within that spine can so easily shift left, right, forward, back, and those little movements can put pressure on the spinal cord and affect the growth, development, and the health of that baby, or translate into that toddler's life, or that child's life, or that teenager's life. So I like to see children and check them to see if they need to be evaluated all the way back to day one when they come onto this earth and they are born. I like to evaluate them. This is what I've done with my children to see what I can do. And then you're thinking like, oh, how do you adjust a baby? Because I don't want you twisting and cracking my baby's neck. And that's not what we do. In fact, adjusting and shifting the spine is very gentle, much gentler than birth that they've gone through. It's just wiggling with my fingertips to put it in place, or using a tool. This is called an activator, in very specific spots so that I can restore the alignment to the spine, activate those nerves to work properly to allow the body to heal and to function. So oftentimes I see mothers that have children that their babies have ear infections, maybe they're colicky or crying a lot, maybe they have sleep disturbances, or they have digestive disruption. Those are my most common reasons to see babies, but I like to see them even when they're healthy, because isn't that the best news that a mom could get, is that your baby's spine's in alignment, they're growing, they're healthy, and let's just keep it that way and they won't have any issues moving forward and growing up. Now, past the infant stage, moving into the toddler stage, children fall about 1,300 times before the age of 2. Could you imagine being pushed off the couch 1,300 times? Yes, there would definitely be some shifting, some movement to any of your bones in your body and possibly your spine. And so that's why I like to check toddlers, because they're learning how to waddle and crawl and walk, and they fall so commonly left, right, forward, back. And again, just a tiny shift in that child's spine, just a very tiny shift left, right, forward, back, can impose on these nerves or the function of the spinal cord or the function of the spine. So restoring alignment for your toddler is going to be effective and safe and really, really help them grow and develop as they should. Then as we walk into our later children and teenagers, they might complain of things like headaches, allergies, digestive disorders, problems there, problems sleeping, problems focusing and concentrating. So I've seen a lot of patients with ADD, ADHD, and concentration issues, or even on the autism spectrum, because it's all about getting the body functioning on the inside so the rest of the body can heal like it's supposed to. So your older children, again, we would check. Do they have proper alignment into the spine? Do they have the curves in their neck and their mid-back and their low back? Are things distorted and straight? Are things rotated or twisted? These are important things to know so that they can be functioning on the inside. Now, our children are looking down at screens, phones, iPads, computers, or maybe they're looking down and doing homework and books, and oftentimes what I see is that position and posture is pathological to them because it's straightening out their spine and putting pressure on the back part of it. This poses a hazard to them for later on in life. There's going to be damage to the muscles here, and there can be loss of function through the spinal cord and the nerves and the function there. Other things that can affect your child are your belly sleepers. So your belly sleepers that twist their neck at night, all night for 8 hours, 10 hours, 12 hours. And that's going to be putting compression on the spine and on the nervous system and allowing for problems to grow and develop later on in life. Other things they may be experiencing are playing in impact sports. So we've got football, we've got soccer, basketball, hockey, all of these things where there's lots of impact happening, and there's lots of opportunity for trauma or damage to the spine. So if your child has gone through any of those sports, why not get their spine checked? Why not check and see, are things in alignment? Are they in a good place? Are they healthy? Maybe your child isn't really into sports. Maybe they're not athletic. Maybe they're into music and they play the trombone and their posture is I don't play any instruments, this might not be it, but I mean the drums, the trombone, the flute, all of these positions, the piano, are opportunities for there to be damage, subluxation, or issues with the spine. That being said, we love to check and evaluate kids here in the office because I know the opportunities they have later on in life, or if they're struggling with any of the current health conditions that I was just talking about, concentration, digestive issues, allergies, colicky, ear infections, any of those things are things that we can help with if there's issues with the spine, and if we can just correct that for them, it just sets the stage for a super healthy kid and growth and development, and just helps them be the best them. Hope this was helpful. Like and comment below. Certainly direct your questions to us, and we can get them answered. Have a great day.
Hey guys, thanks so much for watching this video. If you want to connect with us and learn more, we're constantly shooting information or shooting videos. We actually have a blog as well, and we have a website where you can learn so much more. If you want help with your health, you can actually connect with us, come into our clinic, or jump on a phone call with us and see if we can help you. To do that, go to the links below in the information area and click those areas, and then you can move forward and see how we can actually address and help you with your health issues as well.